A 67-year-old gentleman awoke feeling perfectly well. He reported no chest discomfort, no difficulty breathing, absolutely no preliminary warnings whatsoever. He felt excellent, perfectly normal, just like any standard Tuesday morning. He proceeded with his established routine, leaping out of bed, heading straight for the bathroom, and immediately setting the shower to cold. Influenced by something he'd previously read regarding its purported benefits, then stepping in. 20 minutes later, his wife found it necessary to dial 911. I was the cardiac surgeon who was on call that particular morning. I immediately sterilized my hands and proceeded into surgery. Fortunately for him, the outcome was positive. However, I have personally witnessed circumstances precisely like his that concluded in drastically different, much more severe ways. They concluded very differently. What transpired with this patient was not a random, unpredictable occurrence. It was neither unfortunate timing nor sheer bad luck. Instead, it stemmed from a sequence of errors that were entirely preventable. These are mistakes that countless individuals over the age of 60 inadvertently repeat every morning without any awareness of the risk they present. My goal today is to clearly lay out those errors and prescribe the correct alternative actions. So why is the period immediately after waking so inherently perilous? Let's begin with some objective figures. Medical findings published in the American Heart Journal clearly indicate that the probability of a cardiac event experiences a substantial elevation between 6 a.m. and 10 a.m., markedly surpassing any other part of the day. We are discussing a risk increase of approximately 40% across those 4 hours. 40%. This is far beyond a slight statistical anomaly. It represents a persistent pattern that cardiologists have monitored for many years. It even has a specific clinical designation. We term it the morning surge. And for anyone past 60, that surge impacts the body more forcefully and swiftly, leaving significantly less room for error compared to when you were 40. Here's the precise underlying reason. During periods of sleep, your physiology operates in a reduced power setting. Heart rate lowers, blood pressure descends, and your entire nervous system is at rest. Yet the instant you begin the process of waking, even before your eyelids flutter open, your system initiates a forceful gear change. Picture aggressively pushing the accelerator in a vehicle that has sat dormant in a frigid garage overnight. The engine is not yet prepared, the oil has not circulated, and you are demanding full performance immediately. Introducing a couple of prevalent habits that most people mistakenly believe are health-promoting sets the stage perfectly for a potential cardiac incident. Here is a crucial fact that evades the awareness of many. Your body's primary stress hormones, namely cortisol and adrenaline, do not await your physical awakening. Their ascent begins roughly 60 minutes prior to your actual waking moment. Your physiology is actively preparing you for the day's demands while you are still immersed in sleep. By the time your alarm sounds, cortisol levels are already climbing rapidly. Adrenaline swiftly follows suit, and in tandem, they place a significant load upon your heart. In quick succession, these hormones instigate 3 primary physiological shifts. First, your cardiac rhythm accelerates. Second, your systemic blood pressure increases. Third, your blood vessels experience constriction. All 3 of these rapid alterations frequently materialize within mere minutes, sometimes mere seconds. Now, when you are 35, your cardiovascular structure effortlessly manages this sudden surge. The vessels retain elasticity, and the heart muscle is robust. But past the age of 60, the operational picture changes considerably. The walls of your arteries become less pliable, and the system does not adapt with the same speed. Furthermore, there may be existing plaque accumulation within those arteries. Plaque you remain entirely unaware of because you perceive 0 symptoms of illness. When this intense hormonal wave strikes an artery containing such vulnerable plaque, the sheer physical force can cause it to fracture. A fractured plaque is the immediate precursor to the formation of a clot, and the formation of a clot within a coronary artery is unequivocally a heart attack. This is not a far-fetched worst-case scenario. This is the demonstrable physiological mechanism I observed directly during an operation. Long before you have consumed your initial morning caffeine, your heart is already functioning under greater strain than it was an hour prior. The actions you take in the ensuing 5 minutes will either assist your heart in managing this increased workload or escalate the situation dramatically. Ask yourself this question right now. Are you aware of what your blood pressure reading is immediately upon waking? If the answer is no, then correcting that knowledge gap is the very first imperative change. Here is another point that invariably catches people off guard whenever I introduce it. Following 7 or 8 hours of uninterrupted sleep, your body is, without exception, in a state of mild dehydration every morning. You have gone the entire night without a single drop of water intake. Moreover, you have been continuously breathing, a process that results in constant moisture loss from the body. The resulting consequence? By morning, your blood is demonstrably thicker and has higher viscosity than it was the previous evening. Consider this mechanical analogy. Visualize your heart as a high-powered pump and your circulatory network as a system of connected pipes. When the fluid coursing through those pipes is thin and flows with ease, the pump expends minimal energy. However, when that fluid becomes dense, the pump must exert considerably more force to propel the equivalent volume. Consequently, every single contraction demands increased exertion. Beyond simply taxing the heart, thicker blood exhibits a heightened propensity for clotting. The risk of developing a dangerous blood clot is significantly amplified during the early morning hours. Published research confirms that blood clotting factors reach their peak level of activity precisely in the first few hours after sunrise. This synchronization is far from accidental. This compounding of factors is one primary explanation for why strokes and heart attacks exhibit such a pronounced clustering between 6 and 10 a.m. You have the initial hormonal spike coinciding with the presence of thickened blood against the backdrop of potentially stiffened blood vessels, a formidable triple threat to any heart over the age of 60. The remedy for this particular issue is almost embarrassingly elementary. Consume a full glass of room temperature water before initiating anything else. Before coffee, before taking medication, and before even glancing at your phone, you must rehydrate first. This constitutes one of the habits requiring the lowest level of effort, but yielding the highest impact on your cardiac well-being, and astonishingly, virtually no one incorporates it consistently. Your assignment tonight is to place a glass of water right by your bedside. Make this the simplest new habit you have ever successfully adopted. Allow me to be completely candid with you. The concept of subjecting oneself to cold showers has experienced an enormous boom in popularity over the past few years. Social media is saturated with examples of individuals immersing themselves in icy baths before 5 a.m., championing the cause of discipline and mental fortitude. Exposure to cold does possess genuine physiological benefits. I will not dispute that reality. However, here is the critical piece of context that those viral videos consistently fail to broadcast. The timing of this exposure is immensely important. For anyone who is over 60, deliberately stepping into a cold shower immediately upon rising presents a serious acute cardiac stressor. Here is the physical sequence. The instant that icy water makes contact with your skin, your body initiates what is known as the cold shock response. To shield your vital core temperature, the blood vessels located immediately beneath the skin constrict with great speed. Simultaneously, your heart rate escalates sharply and your blood pressure spikes upward. We are referencing an acute jump in systolic pressure of 20 or occasionally 30 points, all occurring within mere seconds. This constitutes a major abrupt cardiovascular shock. Now, recall your status a few moments earlier. The natural morning hormone surge was already elevating your pressure, and your blood was already more viscous than usual. Now you are deliberately adding a sudden, violent peripheral vascular constriction on top of that entire unstable foundation. A healthy 30-year-old's body will absorb that impact without issue. However, for a 65-year-old exhibiting even minor arterial stiffness, that intense spike can act as the precise trigger. It has the potential to crack existing plaque, induce a coronary artery spasm, or provoke a serious, potentially fatal arrhythmia. The very gentleman I mentioned at the beginning, the one whose story began this conversation, the cold shower was identified as the definitive trigger event for him. His arteries were not described as being in catastrophically poor shape, but neither were they pristine. In that precise combination, the morning hormone surge compounded by the cold shock, it proved to be overwhelmingly too much strain. Therefore, what is my professional counsel here? Initiate your shower at a warm temperature approximating 37 degrees Celsius or body temperature. This allows your circulatory circulatory system to transition gently instead of being shocked. If you are devoted to the concept of cold exposure, reserve that icy blast for the final 30 seconds of your bathing routine. By that juncture, your vessels will have had sufficient time to adjust and perhaps even dilate slightly, and your baseline pressure will have stabilized somewhat, meaning the cold shock registers far less severely. This is one minor modification that yields a substantial difference for the integrity of your heart. How exactly do you transition from lying down to standing up in the morning? Be forthright with your self-assessment. The majority of individuals proceed from a horizontal orientation to a vertical one in roughly 2 seconds. The alarm sounds and they are up, feet planted firmly on the floor, moving. I fully grasp the necessity of adhering to a schedule, but this abrupt change in posture is physiologically problematic. This is the physiological sequence. While you remain lying flat, the volume of blood in your body is distributed in a relatively even manner throughout your entire system. The second you achieve a standing position, gravity exerts its force, pulling a considerable volume of blood downward towards your lower extremities and abdomen. In response, your heart must immediately constrict vessels and elevate its rate to ensure adequate blood flow and thus sufficient pressure reaches your brain. In younger individuals, this compensatory reflex is executed swiftly and efficiently. In older adults, this reflex is demonstrably slower. The arterial walls do not recoil rapidly enough. We assign a clinical term to this condition: orthostatic hypotension. Blood pressure can plummet by 15, 20, or even 30 points within the initial seconds of standing. That sensation of momentary dizziness, lightheadedness, or the graying out of your vision upon rising, does that sound familiar to you? A significant percentage of people over 60 experience this and unfortunately dismiss it as a normal part of aging. It is not normal. It is an explicit warning signal being broadcast by your cardiovascular system, and the potential ramifications extend far beyond simple discomfort. Orthostatic hypotension stands as a leading precursor to injurious falls among the elderly population. A serious fall at the age of 65 can easily initiate a cascade of medical complications that threaten life. For an individual already contending with compromised cardiac function, that sudden pressure drop compels the heart to overcompensate aggressively, resulting in an abrupt increase in rate and output within seconds. In a vulnerable heart, that very compensatory spike can be the trigger for an arrhythmia. In acute cases, this postural change can precipitate a full cardiac event. The corrective measure for this requires absolutely no expenditure whatsoever. It demands only 10 seconds of deliberate mindfulness. Before you attempt to stand, remain seated on the edge of the bed for a full minute. Allow your feet to dangle. Gently rotate your ankles a few times. This allows gravity to act progressively and gives your blood pressure adequate time to stabilize before the sustained demands of the upright posture begin. 10 seconds in this transitional pause is sufficient. Following the minute of sitting, stand up slowly and deliberately. That deceptively simple shift in sequence can successfully avert a dangerous fall, prevent an arrhythmia, and forestall an outcome infinitely worse. I have personally observed patients suffer the consequences, and I know definitively which side of that postural transition I prefer my patients to occupy. Let me pose a direct inquiry to those of you watching. Are you presently on medication intended to manage blood pressure, perhaps one categorized as a diuretic, frequently known as a water pill? If your answer is affirmative, there is a critical detail that your prescribing physician may have omitted, and it is essential that you become informed about it. Diuretics achieve their therapeutic effect by signaling your kidneys to eliminate excess fluid from your system, thereby reducing overall blood volume and lowering pressure. They are highly effective agents and are prescribed across the board. Herein lies the potential catch. As the kidneys expel this fluid volume, they concurrently excrete essential electrolytes, particularly magnesium. Magnesium, however, is not an optional supporting mineral. It is fundamental. It serves as the primary regulator for the delicate electrical impulses that govern your heartbeat's rhythm. It plays a crucial role in ensuring the heart muscle relaxes appropriately between beats. When magnesium levels begin a subtle decline, the heart tissue becomes electrically sensitive or unstable. This instability can manifest as palpitations, noticeable skipped beats, or more severe rhythmic disturbances, arrhythmias. Critically, this instability can develop without any apparent overt warning sign, especially because the early morning hours already position the heart under peak exertion. A depletion of magnesium will impact the system most profoundly at that precise time. I have personally witnessed cases where morning-only arrhythmias completely resolved simply once we accurately diagnosed and corrected a concurrent magnesium deficit. This situation is far more prevalent than many clinicians suspect. If you are taking a diuretic medication, I strongly urge you to request that your doctor order a simple magnesium level check during your next routine laboratory workup. A standard blood test requires only 2 minutes of collection time, and that data could prove genuinely life-altering for your cardiac safety. Do not assume stability merely because testing has been overlooked. Now, I anticipate the immediate thoughts surfacing among some of you. Doctor, I engage in exercise every single morning. My physician emphatically stressed the importance of activity for my heart. In this regard, your doctor is fundamentally correct. Physical activity remains one of the absolute best interventions for long-term cardiac health at every stage of life. Full stop. However, and this is a profoundly significant however, the element of timing and the level of intensity during the morning hours matter far more than most people comprehend. Here lies the inherent issue. During the early morning, cortisol levels are peaking, systemic blood pressure is already elevated, the blood possesses higher viscosity, and the heart is, by default, operating with an increased baseline workload. Now, introduce the concept of immediately launching into a strenuous, high-intensity workout without a proper lead-in. In this compromised state, where there is no gentle warm-up period, you are instantly driving your heart rate up on top of an already heightened morning baseline. Blood pressure climbs even further atop the pre-existing elevated morning level. And finally, your coronary arteries, already subject to mild constriction from the early hormonal response, are suddenly tasked with delivering drastically increased oxygenated blood to the highly active heart muscle itself. Research documented in the journal Circulation discovered that forcing vigorous exertion during the initial morning hours correlates with a measurably greater inherent risk of precipitating a cardiac event in adults past 60. This observation does not imply that morning exercise should be abandoned. It strictly means that you must adopt the philosophy of walking before you sprint, both literally and figuratively. Allow your body a minimum of 20 to 30 minutes to physiologically awaken, hydrate effectively, and achieve internal equilibrium before you introduce any activity that requires significant cardiovascular output. A gentle stroll is entirely appropriate during this period. Slow, deliberate stretching routines are also highly suitable. Save the vigorous intensity for a later point, after your system has safely managed its transition into an active, alert state. When you exercise in the morning, reflect honestly. Do you execute a warm-up, or do you simply commence your intended workout immediately? Share your current practice with me in the comments section below. Now, we arrive at the crucial juncture. You have grasped the intrinsic dangers associated with the morning period. It is time to transition to practical strategy. Knowledge without application only breeds anxiety, and my purpose here is explicitly not to elevate your stress levels. Rather, I intend to equip you with a definitive, actionable blueprint. This is what I have titled the 5-Minute Morning Protocol. It requires zero specialized equipment and carries no direct cost, yet it offers tangible cardiovascular defense every single day. Minute 1. Conscious waking. When your alarm sounds, exert total stillness. Remain precisely in the position you are in. Intentionally execute 3 very slow, deep diaphragmatic breaths, inhaling slowly through the nose and exhaling smoothly through the mouth. This simple act actively engages the parasympathetic nervous system, the body's primary calming branch, to begin counteracting that sharp cortisol surge before it can reach its maximum peak. 3 deliberate breaths are all that are required to activate this potent cardiovascular safeguard, and it is completely free. Minute 2, hydration precedes movement. Ensure a glass of water is ready on your bedside table tonight. Before even shifting your weight or allowing your feet to contact the floor, consume that entire glass of room temperature water. This initial fluid intake begins the process of naturally thinning the blood, thereby mitigating the elevated morning clotting risk, and furnishes your circulatory system with necessary resources before the cardiovascular demands of the waking day commence. Minute 3, the crucial pause before standing. Roll gently onto your side and use your arms to slowly assist yourself into a seated posture on the very edge of the mattress. Do not hurry this stage whatsoever. While seated, deliberately rotate your ankles in complete circles, executing 5 full rotations in each direction. This mechanical action stimulates the major muscle pump located in your calf area, actively aiding the movement of blood back toward the heart before gravity pulls it forcefully downward. Minute 4, gentle mobilization. While you are still seated on the bedside edge, initiate very slow, controlled movements. Gently nod your head side to side. Deliberately raise your shoulders towards your ears and then release them downward. Extend both arms overhead in a full, comfortable stretch. You are effectively awakening the muscle fibers incrementally, increasing overall circulation in a gradual manner, permitting your resting heart rate to elevate at a pace that your physiology can comfortably accommodate. Minute 5, deliberate rising. When you finally proceed to stand, push through your legs and ascend at approximately half the speed you would normally employ. Once upright, stand completely motionless, ensuring both feet are flat on the floor for a minimum of 10 full seconds. This deliberate pause permits your blood pressure to fully recalibrate to the vertical orientation before you take that first step. 5 minutes total. On the days you adhere to this regimen, your heart commences the day feeling defended rather than ambushed. I need you to deeply consider something for a brief moment. Everything I have detailed to you today is entirely non-exotic. None of these practices are rare or obscure medical procedures. These physiological events, the hormonal surges, the rising blood pressure, are occurring in bedrooms across the entire nation every single dawn in residences identical to yours, impacting individuals who, like the 67-year-old, feel genuinely fine and are completely unaware of the inherent vulnerability. That specific aspect is what remains with me the most after nearly 2 decades as a practicing cardiac surgeon. The cases that truly resonate are rarely the most technically complicated ones. They are consistently the ones that were completely preventable. I recall the 68-year-old retired educator who suffered an event while simply rising from his bed on a Wednesday morning, or the 71-year-old grandfather who stepped into a cold shower one moment and never took another step thereafter. These were not people characterized as being inherently unwell in the conventional medical sense. They were individuals simply lacking the specific information I am sharing with you right now. And here is perhaps the most pivotal realization I can impart in this entire presentation. The morning risk window is a genuine clinical reality. The supporting scientific evidence is unambiguous. Crucially, however, this risk is one of the most easily managed factors within the entire scope of cardiovascular health management. Why? Because unlike genetic predispositions or the cumulative effect of decades of dietary choices, your immediate morning sequence of actions is entirely within your power to alter starting today, this afternoon, well before tomorrow's alarm sounds. You require no surgery. You do not need a new pharmacological agent. What you require is 5 minutes and the intelligence you have now assimilated. The gentleman whose life I salvaged that morning, the 67-year-old, made a complete recovery. He returned for a follow-up consultation 3 months later, and the first words he uttered were, "Doctor, why had absolutely no one explained this essential process to me previously?" That simple, probing question has remained profoundly influential in motivating my decision to produce these educational videos. Now, the essential query shifts entirely to you. What specific measures are you resolving to implement based on this knowledge? To ensure you depart from this video equipped with something tangible rather than simply carrying a new, vague sense of unease, let us swiftly synthesize the 5 key actions I want you to commit to applying, beginning with your waking moments tomorrow. First, before initiating any muscular movement whatsoever, pause to take those 3 deep, controlled breaths, consciously permitting your nervous system to transition calmly away from deep sleep before demanding high output from your heart. Second, drink a full glass of water before any of your feet touch the floor. Ensure that glass is placed on your nightstand this evening. Make this hydration the easiest habit you establish. Third, enforce a 60-second sitting period on the bed's edge before you stand. Perform those ankle rotations to actively encourage necessary blood return toward the heart before you confront gravity fully. Fourth, if you are prescribed a diuretic, follow up at your next appointment to ensure your magnesium levels have been assessed. One simple blood test is the only necessary step. Fifth, for those who exercise in the morning, provide your body a minimum lead time of 20 minutes of low-intensity activity before you introduce any elements of strenuous exertion. In all circumstances, prioritize walking before running. Now, here is the question I genuinely seek your response to in the comments. Which of these 5 habits are you already integrating into your routine? And which one of the new pieces of information shared today genuinely surprised you the most? Your feedback is valuable as it helps me better gauge subjects for future explanations. I review every comment submitted. If you found any value in this presentation, please share it deliberately. Do this not for my benefit, but for that person you know who is repeating the exact dangerous routine I described every morning. They may not yet realize the risk, but you recognize the relevance, which is precisely why you watch this far. Prioritize the health of your heart. It has served you faithfully every single second of every single day without ever requesting a reciprocal gesture. Dedicate 5 focused minutes to it each morning. That is a perfectly reasonable exchange, and it commences tomorrow. One final vital clarification. Everything communicated here today is rigorously grounded in established, published cardiovascular research and my cumulative clinical experience as a cardiac surgeon. However, your individual health profile is unique to you. Before making any changes to establish medication routines, exercise regimens, or your core morning structure, it is imperative that you first consult your personal physician. They possess comprehensive knowledge of your medical history. I do not. Treat this content as valuable education, not as a direct treatment prescription. Utilize it as the groundwork for that necessary conversation with your doctor. I am Dr. Jiang Xueqin.